I am Dr. Vidya Thobbi, Professor, Head of the Department Obstetrics and Gynecology, Al-Amin Medical College, Bijapur. Chairperson, Food, Drugs and Medico-Surgical Equipment Committee, FOXY. I am here for the FOXY's digital initiative and I'll be talking on hyperhomocystenemia, its implications and management on 7th of January from 3 to 4 p.m. Please join me in this initiative. January 5th to 11th is celebrated as Folic Acid Awareness Week. And folic acid deficiency not only causes various congenital abnormalities like spina bifida, but also it causes placental abruption, then preeclampsia. It also causes low birth weight babies. Now, folic acid deficiency, most of the women are unaware and they need to take folic acid preconceptionally as well as periconceptionally. The majority of the Indian diet is vegetarian because of various cultural and religious taboos. So we are deficient in the folic acid in our diets. That's why it is very essential to provide folic acid and folates in our diet. And even there is a FIGO's initiative, Think Nutrition. So friends, let us find out the solutions. What are the solutions for the folic acid deficiencies, its complications, management, how the folic acid and hyperhomocystenemia are related. We can contribute a lot to the improvement of the nutritional status by educating women, making them aware, and a stitch in time always saves life. Even Center for Disease Control says that more than 1,000 babies are born with spina bifida every year. And National Institute of Health also reports that once the patients are having the risk of neural tube defects in this pregnancy, there is a recurrence risk of these neural tube defects in the next pregnancy as well. So we have to supplement these women with the deficiency of the folic acid with increased dosages. Wishing you a very happy new year. I thank our dynamic President FOXY, Dr. Nandita Palshetkar, for this initiative, and the division of Zydus, that is Gynae Next, for the support, and for the technical support, the doc mode. Thank you very much.